veteran in the field of medical aesthetics, or if you're new to the field, you know to secure your first job in your medical spas or doctor's offices are pretty tough. You know, at least 90% of the offices, wellness centers, they want someone with at least 1 to 2 years of experience. And if you're an injector, at least 3 years of experience, which is impossible nowadays. Now, that can seem very unrealistic, especially when a lot of the treatments that they offer now, like micro Botox or laser facials, those have only become popular in the last 3 to 4 years. And before that, it was simply lasers, Botox, and fillers. Take us back to the simple days. So for a company to want you to have that much experience seems a bit unfair. So in this video, I'll talk to you about how to obtain that experience, how to build your resume portfolio, and obtain your dream job. Because the field of medical aesthetics, whether you're an esthetician, a nurse practitioner, a nurse, a medical doctor, it really is a fun and innovative and ever-growing field. And it honestly beats the hospital, let's just be honest. For those of you who don't know me, my name is Maya. I'm a family nurse practitioner, and I am the founder of the NLAA Training and Treatment Center, where we train ethical and competent providers. So if you're interested in advancing your career in the field of medical aesthetics, or if you're a patient looking for a med spa home, feel free to click the link in the description for a consultation. So the cost to train a provider in the field of medical aesthetics can range from $3,000 to $10,000 for some medical offices. And a lot of doctors' offices and med spas, they just don't want to take that risk. And by taking a risk, I mean training a medical provider, getting them their certifications, paying for them to get their certifications and their trainings, and after spending maybe a year and a half and 2 years in your medical office, they leave and they go take that experience somewhere else. So, you know, in their defense, it is kind of a risk because they've spent all this money, but their return on investment is out the door. So where does this leave new providers? Well, you're going to have to invest in yourself. So hiring someone with at least 1 to 2 years of experience where you can actually tweak up their skills a little bit, or bring in someone from the companies like Dysport or Allergan, Galderma to tweak up their skills, that's a little safer and cost effective for a lot of these companies who are starting out with no patients and no money. So you're going to have to take the necessary steps to make yourself marketable in this field by getting trained by credible and resourceful companies. Now, when you're looking for companies, you want to make sure that you do your due diligence by educating yourself on what's included in these certification courses, and if those courses meet the requirements that your dream job is going to require of you. Some things you want to factor in is, of course, the cost of the course. If you have to travel, whether that's gas travel or airfare, and then also if they offer resources after you've become certified. Because a big mistake that a lot of practitioners and treatment providers and estheticians make is after they've become certified, they've only treated maybe 1 or 2 people in the actual certification course. You want to make sure that this company offers resources to help you sharpen your skills and your knowledge after you've gained that certification. And after you've gained your certification, go and apply to jobs that are in your career field. So for instance, if you're an RN, an NP, or a PA, go and apply to jobs in a doctor's office or a dermatology office that treats medical patients, but is also starting to trickle in those med spa treatments like Juvveau and Xeomin and facials and laser hair removal. And mainly the ones that offer the skill that you have just become certified in. And seek out opportunities to start to treat new patients, or just patients in general. Now, I will say a lot of the times when you're in an established practice that offers a plethora of treatments, and they've been offering them for a while, the established patients have a tendency to gravitate towards the provider that they know. They just don't want to take the risk of a training or a new certified provider. Start with your job description, but then start trying to treat patients in what you've become certified in. You don't want to wait a year after you've become certified to go and try to start treating patients, because you're really new at that point. You don't even remember a lot of the things that you were trained in. Then also build your references with these companies. If a new job is asking for references, you have names of managers, coworkers, even patients that you have treated. Now that you have a little bit of experience, I would say at least spend 1.5 years at your first job getting that experience. Even if you could stay there for 2 years just to get comfortable and build that experience up before you apply to whatever dream position, whether that's working in a big franchise or working in a medical spa or wellness center. Even if you don't meet all of the skill requirements, you just never know what they're actually looking for. Even if they give you all of these requirements, however many years, and this is with any job really, you could have 1.5 to 2 years of experience and they're looking for at least 2.5 years of experience. Apply for the job. And as someone who's had to hire providers, if you are already certified and you have a little bit of experience, I can mold your skills to what I want for my company. Also apply, because you really never know who you're up against. A lot of the companies where they require 3 to 5 or 5 years of experience being an aesthetics injector, a lot of their applicants are going to have 2 to 3 years of experience. And you know why? Because the injector who's had 5 years of experience, they don't really want to work for a franchise anymore. A lot of the times I've seen them want to branch off. They've established a trusted base of clients. They're making their money. They've probably taken some classes on how to build your business. So they're ready to branch off and probably rent from a salon suite. They're not really trying to work for franchises or work for anybody anymore because they've built up their client base and they've built up their skills. But that can work in your favor. My last step or tip would be to continue to get certified, whether that be in the staple treatments like your neurotoxins, your dermal fillers, your laser treatments, your microneedling, dermaplaning, your facials, your radio frequency. Continue to get certified or become certified in those. And then later on, start to trickle in the trend treatments. You know, TikTok always has some type of trend that's going on, and then the rest of the world brings it into the medical spas. But stay up to date on all of your treatments and all of your training. I have listed a few of the resources and foundational courses through NLAA that you can take and become certified down in the description below. And if you have questions about your personal journey in medical aesthetics, or if you're a provider and you don't know where to start, but you know you want to start in the field of medical aesthetics, feel free to book a Zoom call with me or email my main office at info@nlaatraining.us. I'll talk to you soon.